The holiday season is a time to celebrate and to be around loved ones. But this year, everything from Christmas markets to family gatherings is having to be scaled back due to the COVID-19 pandemic. Social distancing and other restrictions have left many feeling less than festive. So what should a good COVID Christmas look like? This is DW's COVID-19 special. I'm Janelle de Malaon. As Germany grapples with yet another record number in coronavirus cases, it's weighing up how best to allow for merrymaking while keeping the virus from spreading. And all across Europe, it's a similar picture. People are breaking with tradition as they change their plans to accommodate restrictions.
Here in the Spanish city of Sevilla, the Christmas lights that you see behind me stay off at the moment, even at night. The city administration is afraid of big crowds that might come and watch them. The general restrictions for Christmas here in Spain are not clear yet, but everybody knows this will be a very different festive season. Even in my own family, which is partly German and partly Spanish, we don't know what to do yet and if we will be able to meet each other at all.
Normally at this time of year, the place behind me would look totally different. There would be lots of Christmas market stands and the smell of roasted almonds everywhere to get you in the mood. But what I personally miss the most this December is meeting friends in the evening and drinking mulled wine together. The only thing that cheers me up this year is mulled wine to go. Cheers and Merry Christmas.
Now, how to strike a balance between necessary interpersonal contact and the required social distancing is a big question for many of us as the Christmas holidays get closer. Here to help us understand this better is Tegan Cruis. She is an associate professor and clinical psychologist at the Australian National University. Thank you very much for joining us, Tegan. Now, according to your research, our risk perception during an encounter with a person depends on how well we know them. Why is it that people find it so hard to take the necessary COVID precautions with the people we love?
It's something we've been looking at for a number of years in our research group. And one thing that we've found is that there's this consistent relationship where people are much more willing to take risks with the people that they are closest to, the ones that they love. And that seems to be because humans are sort of hardwired to use that sense of social connection we have to others, the groups that we belong to and the communities that we value. We use that as a cue to safety. It's a signal that we can trust someone and that they are a safe person for us to, put our life in their hands. And in some ways that makes a lot of sense. If you're looking for someone to take care of your children, your closest networks probably are the people you can trust the most. On the other hand, when it comes to the spread of a contagious disease, it doesn't make a lot of sense. And so I think that's what we're seeing here is that our instincts to trust those that are closest to us are actually undermining our safety when it comes to COVID-19.
Our hardwired instincts putting us at risk, that can be quite a problem. But can you tell us, Tegan, how did you come to these conclusions?
Yeah, we've been conducting a series of studies over a number of years, including before COVID. So we were interested in this over the last few years and ran a few studies looking at risk perception. But we've also looked at it since the pandemic began. And one nice opportunity we had to do that was a study that we had running at the beginning of March, and we were looking at neighbourhoods and people's connection to their community. And the original intention was to look at people's sort of participation in community events. But when the pandemic really gained steam in March, we changed the purpose of one particular project in order to look at how this particular research question around the link between our group memberships, the trust we have in others, and our risk perception. And what we found was that in our sample of a couple of hundred people in Australia, the stronger that people identified with their local neighbourhood and their community before COVID, so in early March, the more likely they were to trust their neighbours in lockdown, which sounds like a great thing. But the problem in this case with trusting one's neighbours was that also predicted that they were more comfortable being in close contact with those neighbours. So breaching physical distancing recommendations, for instance, and spending time in the physical presence of their neighbours felt safer because they had that trust in their neighbours. So that would be an example of one of the studies we've run looking at this link where social connection and the sense of belonging we have with others, which is usually such a protective and positive thing, can actually undermine our capacity to respond to a pandemic of this nature.
Indeed, and if social contact is needed to stay healthy, but at the same time it puts us at risk, what are we to do then?
Yeah, it is a bit of a catch-22, I think, because I certainly wouldn't want to say that social connection isn't important. I think it's one of the most important things when it comes to protecting our health and indeed our mental health over the long term. And it's also the case that people who are most vulnerable to COVID-19 complications are often the same people who are vulnerable to loneliness, to isolation, and to the poor health consequences that we see as a result of that. One of the things I think that 2020 has really necessitated for all of us is to be creative about how we stay connected to one another, whether that's through using virtual means in ways that we might not have considered prior to this year, or whether it's choosing to get together outside or in a socially distanced, more safe way of getting together and seeing our closest contacts. I think we need to find compromises that allow us to stay connected while taking as fewer risks as possible when it comes to COVID.
You've written that the critical role of shared identity and therefore of higher risk-taking has been under-recognized in public health messaging. How exactly should public health messages change, in your opinion?
I think that there perhaps hasn't been much attention to the difference between the risks we're willing to take with strangers on public transport, out in our communities, versus the risks we're willing to take within our closest networks, with our families and with our friends. And the problem with that is that we're actually very, very ready to accept the risk of strangers, but much less ready to recognise and accept the risk in our closest networks. And in fact, that's exactly where the vast majority of COVID transmission is happening. It's happening in households, it's happening at small gatherings of family and friends. So I think ideally I'd like to see public health messaging really be a bit more focused on how we can reduce those risks in our closest networks and how we can celebrate important milestones like birthdays and Christmas without putting the people we love in danger.
So, social distancing, protecting the people you love. Thank you very much. That was Tegan Cruis. She is an associate professor and clinical psychologist at the Australian National University. Thank you for your time and insights today.
Thanks, Janelle.
And for the final time this week, our science correspondent Derek Williams answers one of your questions.
For a 20-year-old, what's the risk of taking a vaccine compared to not taking it?
Most of the questions I'm getting at the moment involve potential vaccines, and this one is close to the top of the list. The experts I've read who discuss this topic make several important points. First of all, they say you should look at the numbers that we have so far, like the data showing that for tens of thousands of people in 3 big vaccine trials, there have been no reported serious side effects, although bear in mind that those test subjects didn't have known pre-existing health problems. For people who do, there could be more risk involved. We've just heard, for example, about a couple of cases of people in the UK who had pre-existing allergies having a bad reaction to one vaccine. But the experts still say that the potential risks pale in comparison to the risks involved in catching the virus. Sure, a 20-year-old is a lot less likely to die from COVID-19 than an 80-year-old is, but some do. Why take that chance if we have something that medical authorities say can safely protect you? Which brings me to point 2. Even if a young person is much less likely to die from the disease, there's also a chance that a COVID-19 infection could cause long-term health issues. By some estimates, up to a third of those who recover continue to have more chronic complaints. That doesn't seem to be age dependent. So young people have them too. Point number 3, getting vaccinated also has a social aspect, which is that it could potentially help protect the people around you. Though that question, granted, is still up in the air. Still, expectations are high that if vaccines stop people from developing fully fledged COVID-19, they'll also help cut down on transmission, and that'll slow down the pandemic for all of us. Finally, don't forget that young people who aren't in essential jobs will be pretty far down on the list for vaccination in most countries. By the time most of them can get a shot, we're going to have a lot more information about any potential serious side effects. But based on what we know now, most experts expect those to be very rare.